Hello again, everybody. I want to start our next session with a discussion on project management. Okay, so here are the objectives I'd like you to get out of this session. I'd like you to have some ability to coordinate projects to teams and executives, be able to identify the critical path of any project, and then understand how additional resources can be used to reduce the overall project duration that is caused by the critical path. Okay, so why do we care about project management? Really, what's the purpose? What is the need? Well, projects frequently are late. They're over budget and they do not meet specifications. So I'm sure all of you have seen projects, construction projects maybe around your facilities, even new software. Let's say electronic health record came in. Considerable delays in terms of the overall project time. What often happens is projects are not managed properly. They are not given the amount of attention that they need. And there are so many different people involved and different organizations involved, departments involved in a project that it really takes a lot of focus to keep a project on target and to meet specifications. And when those things don't happen, then it ends up increasing your overall budget. You don't have, let's say, an electronic health record online when you thought you'd have it online. And so what you ultimately miss out on is that competitive advantage. So the definition of a project is a one-time event. So this isn't some recurring process. It's a one-time event. You're trying to accomplish something, and so you have this project associated with it. And there's multiple tasks. So it's more than just one process step or one task. It involves multiple steps, typically multiple departments, and it tends to be larger in fairly large in scope. So it's not something that's really small that you would essentially have a project management focus on. These tend to have project managers involved with the larger projects. So there's a start and end date, and ultimately you have a budget and some outcome that you want for that project. So when should you use it? Well, I mentioned if it's complex, meaning it involves multiple tasks, multiple departments, organizations, then you'd want to have project management, because often it is led if you have a project management department, or it's going to be led by just a simple project manager. So here's some elements of project management. You'll start with this initiation and charter over here, and that comes from all of these areas. So in that initiation and charter, you're going to have the scope, you're going to have a schedule, you're going to identify the financial piece, the costs. What quality or communications are you going to employ throughout this to manage the project? What risks are there? And how are you going to procure the project? So meaning, what vendors am I going to use? How am I going to send it out for bid? So how are you going to select those vendors? And then a closeout, which is just what's going to happen when the project is finished. So then you have, once you've identified that charter, now you have your scope. What is in your scope and what is out of your scope? We'll talk about these things all in more detail. And then you have a project plan. Okay, so Microsoft Project is the most common software used for project management. It's a Windows-based software program. And then there's also Gantt charts that can be used for project management. And usually, if they're drawn out of Excel, those people tend to not have project management, or they tend to be very small in scale. You can generate a Gantt chart right from MS Project, Microsoft Project. So, it's a strongly recommended tool. So here's a Gantt chart and how you could theoretically see it look. It starts with certain jobs or tasks. So here's task A, task B, task C. Maybe task A is identifying the vendor. Task B is having the vendor do some sort of site visit. Whatever it may be, whatever your tasks are, they're listed here. And then you have across time, when is task A going to start? So when are we going to send this out for bid? Well, on day 1, we're going to send it out for bid. And that should be done, that activity should finish by day 6. Okay, so whatever day 1 was, 6 days later you should finish. Now here, what this shows is that for task B, it will start on day 2. And then you'll finish it on day 4. Okay, so C, same thing. What this here, this tells you where you are at any given point in time. So it may not look dotted all the time when you do a Gantt chart, but at some point you need to identify in the Gantt chart where are you in terms of this process or this task. So the goal with a Gantt chart is you can see, are you on schedule? Are you behind schedule? If, for example, if you originally budgeted for B to end on day 4, well, did it really end on day 4? Or are we now in day 7 and it's still ongoing? So it allows you to see if you're on time. Okay, here's a Gantt chart in Microsoft Project. So again, you can see it looks very similar. We have all the tasks down here. You have the duration of the tasks. So this is expected to take 0 days, 2 days, and so on. And then you have the dates. So here day 1 was on the 4th of December. So that's why we have this blocked in. Okay. One difference, the thing that you'll see here is whether it's a critical task or a non-critical task. So we have the white boxes are considered non-critical. And so what the difference is, if it's on the critical path, we'll talk about this later, any delay to that process step or that task is going to delay the overall project. Now if it's a non-critical, again the white boxes, one there and one there, well then what that means is if there's a delay to a non-critical task, it's not necessarily going to add time to your overall project duration. Okay, so project selection. How do you decide which project to do? Okay, so let's say you have 10, 20 different projects that you're considering. One way you can do this is you could score it based on certain criteria. So we have the criteria here on the left column, and we have what we consider it as an organization to be kind of the most important criteria all the way down. The next column here is weight. Okay, so which criteria is most important to your organization? So when we look at this row here, or this column I should say, we have linkage to strategy. We've weighed that at 45% and given it the highest weight of any of our criteria. So we consider that to be most important. Project A then scores 7 points. So meaning maybe you scaled it 1 to 10 and you identify, well, what is a 1, what is a 10, and so on. Well, we've decided it's a 7. Okay, so you take 7 times 0.45 or 45% and you get this score. And so you do the same thing for all of these. 15% times 5 gives you this. You go down the list, you ultimately sum them up, and you get a total for project A. We do the same thing for B. So now we score all of these on the same scale, and you get a project B score when you multiply these points times this weight. Now when we look down here, we see project A had 6.3, project B had 5.95. So if we were going strictly off of a scoring system like this, we would want to take on project A before we'd want to take on project B. Okay, now, if the numbers are fairly close, so you may want to consider other factors, but strictly looking at the points, and that's what this does, is it allows you to quantitatively select your projects based on what your organization considers to be important. So again, if you're just comparing one or two, it's probably not as critical as if you have 10, 20, 30, 40 projects and you want to figure out, well, which one should we focus on first. So selecting clinical projects, you may want to consider some of these things. What is the frequency of the occurrence of the disease or condition? Likelihood of success. How large is the performance gap? Meaning, where are we today versus where do we want to be? If there is a big gap, maybe you're looking at some different quality measures, and there's a large gap from your organization to maybe a benchmark or even a median score across the industry, or even comparing to your peers. Those may end up triggering which projects you want to take on first. So here we can look at three different things, four: the time, cost, scope, and performance. So you have a performance, you have the cost, and you have the time. How much time is it going to take you to do this? How much is it going to cost you? And then what kind of performance target are we looking for? What the scope is the scope considers all of those things, and you try to focus in on what you're trying to accomplish. So given we only have $20,000 available, that's going to dictate some of the terms of your scope. How large of a project are you going to take on? What are you trying to do? That's what the scope looks at. So how much time do we have? What type of performance? Very specifically, what do we want to achieve? And you look at all those things and then you come up with a scope. For example, let's say Baptist Health System has 5 hospitals. Well, we're going to focus on Baptist North Central. And we're going to look at the Baptist North Central ED. We have $20,000 to, let's say, fix something, maybe redesign the exam room. So we have $20,000 to fix the redesign the exam room at North Central Baptist within 3 months and expect to achieve some sort of performance level. Okay, so that's what you try to do with the scope. In the scope of work, you'd consider what do the stakeholders want. You'd have some dialogue with those people. Stakeholders can be your patients, they can be your employees, they can be your board of directors. You'd identify with the customer. So what is the customer again? What does the customer want? You have a project sponsor champion for this, for every project, really. So the scope creation, what are the most important outcomes for your stakeholders? And can you measure those? Can you get very specific in terms of measurement? And then you'd come up with the project mission statement, you'd get your team together, and you'd ultimately select or prepare this project charter. So that's how a project gets initiated. Okay, so I'm going to refer to this generic drug use project example. I didn't ask you to read the text or require it, but this was an example in the Health Administration Press from 2012. And so this generic drug use project example, what they have is they have a pay-for-performance program for generic drug use. And the national average use is 70%. The goal for this organization is 4% use increase over what they had prior to this project, or in other words, baseline. Pay-for-performance payments are specific to each clinic, and then they have some goals. Okay. So in this example, in the initiation stage, you're going to identify who are the stakeholders. And they've identified those here. And stakeholders, again, are anybody that's really affected by this project. Outcomes. So outcomes, what are you trying to do? Well, we want to maintain or improve the clinical quality of care using these these generic drugs. Okay, so increase the percentage of generic drug prescriptions is one of our outcomes that we're going to measure, one of our goals. And then increase the pay for performance revenue. So now going back to in general terms, what does a project charter have? Again, I'll touch on these major components of a project, and then I'll go back to the generic drug example to show you how that might look. So in a project charter, you'll have a mission statement, you'll have a purpose statement. So what are you trying to accomplish? Some high-level requirements. So what do you need to perform this project? You're going to assign a project manager to it. Have some milestones, and these are going to be significant milestones for your project. Now, the reason you have these in your charter is the charter is agreed to by every critical member of the organization. So if I'm trying to do something in the ED, I will have the chair of the ED, I might have the nurse manager from the ED. I'm going to have the key staff that are involved in this project. They will sign off on this charter. So that's why you want these milestones in there, because you want everybody to be going for and striving for one common goal. And if people are not hitting the milestones, you'll know it, and everybody will know it. But what this charter does is it kind of holds people to something. You'll have stakeholder influences, functional organizations, so who's participating, what organizations are, and then some assumptions, some financial aspect to this, and then you ultimately have your project sponsor with the signature. So I would encourage everybody who has project charters to get more than just the sponsor's signature, but have signatures from all parties that are key players in this project. Okay, so if the ED is involved in this project, you might want to get a couple key players from the ED to sign off on this. Because what you want to do is you want this project charter to be kind of your backbone of any project. You can always go back to the charter and say, here's what we agreed to. So even though the charter does evolve over time, you have some foundation you can always go back to. Something that was agreed upon. So here's a charter for the generic drugs. I'm not going to spend a whole lot of time on it, but you'll have a mission, and this explains what the mission is of the project, the purpose of the project, why we're doing it, and then some high-level requirements. Okay, so what are we trying to accomplish in this project? Here's the project team, so who's involved in this? And then you have some key milestones. So here they just have that it starts on January 1st. We're going to start testing in 6 weeks and go live at 8. Okay, so you don't get real specific in terms of your milestones. And these are just major milestones is what you'd cover here in the charter. Stakeholder influences. So what you list your stakeholders, and then what is going to be their role in this? The patients will need to understand the benefits of the new system. So that needs to be communicated. That's a patient need. How are we going to address that patient need? Something that we need to consider. Clinical staff, they need to be trained and have the support tools. They say that having system tools are often much more of an indicator of success or failure than the individual person. So it's the system often that leads to success or failure, not necessarily an individual. So are there the support tools in terms of a system to help the clinical staff? And then what organizations are participating? So here we have clinical management staff will lead. There'll be an electronic health record vendor. And then it's going to be the specific Vincent Valley Hospital pharmacy. So again, we want to be specific. Here, what constraints do we have? Okay, well, for one, probably the most important is patients need to understand the benefits of this change. Because otherwise, that will impact your patient satisfaction. It will impact potentially your employee satisfaction if they're dealing with a lot of unhappy customers, unhappy patients. And you want to try to emphasize what is the benefit to all involved, not just the patients. Okay, and then we talked about finances and how much it would cost. Here they put in a payback period and what's the impact of the revenue increase or the increase in generic use. Here's an example of a project charter, again unrelated to the generic drug example that I talked about previously. So you can kind of see it's typically laid out in a one-page document. And you'll often see a project charter. It's very similar to what you'd see in a lean project. One-page document that breaks it out and looks similar to this. Okay, so when you're planning for a project, what needs to be done? Well, you identify the tasks, use experts where possible. So what are all the tasks that we need to accomplish in order to fulfill the goals of this project? And large projects often have subtasks and work packages, estimated costs, and times. What you can do is you can break it down in a couple different ways, and I'll show you those. But here first in generic drug tasks, let's say you need to develop the clinical strategy, the system, and so on. These are your core 6 tasks for that project. Okay, so what you can do is you can develop a work breakdown structure. This is just one way of doing it. You could set up something that looks more like a process map, which I'll get into later. But there's many different ways you can set this up. And the advantage here is you see, here you have this box, management and administration. So what is management and administration responsible for? Okay, they need to develop the clinical strategy and the monitoring system. And we've included how long it should take for those tasks. Here's systems. So what systems approach do we need? We need to identify approved generic drugs and supply the medication list. And then in terms of training, what do we need to do? So this breaks it down more into a functional system. Here's a RASIC chart that shows who's responsible. The R is responsible, A is approval, S is support, I is inform, and C is consult. What that means is that you have each task, and we said there were 6, so all 6 are listed here. Okay, and then you have the responsible parties, or the parties involved. We said this was our team, right? Here was our team, those were listed. And so the clinical board, they are the approval authority for these 3 things. That's their role. Okay, Betsy Thompson, who's involved in this project, she is responsible for some things, and then she also has approval authority on some things. So you can see who is responsible, who has the approval authority, who is there simply to support, or who's there to inform. And then consult, which is what you'd consider probably your lowest level of authority or responsibility. Again, the benefit of this is I can be Bill Anku right here and know what my role is in each of these tasks. Now when I schedule, how do I schedule? Well, I develop the task order. I need to know what must be done before another step can be done. If I can work on multiple steps simultaneously, that's even better. Okay, so this allows you to find that critical path. And it also allows you to graph it out with a Gantt chart so you can monitor the project. The critical path has the longest duration of any path in the process, or in the project, I should say. It becomes the expected length of the time for your project to finish, meaning that if you increase the time to the critical path activity, to one critical path activity, you're ultimately increasing the overall project length. Conversely, if you shorten the duration of one task on the critical path, it may shorten the overall project duration. So here's the critical path. You can see there's multiple paths. So we have this path here that goes into implement, but now we have this path here, and then here, this path, which is the critical path there. We also have this path here, which goes down and then down to patient education and then over. But ultimately, your critical path is the one that's the longest. So you'd add up the duration of all paths and then find that one that's the longest. So crashing a project. Once we've identified the critical path, and let's go back for just a second. You see the critical path with the orange highlighted arrows. If I take staff education and I reduce that to 16 days, well then I continue to factor out each path, and now I find that this says 57 days total. Okay? So if I reduce this by 1 day, now it's 57 days in total. So I still want to have some calculation of the other paths to see, is 57 days now that's still the lowest path, lowest number of days. And if it is, then now my project only takes 57 days. And that was just by crashing this staff education task. So again, takes additional resources, additional time, maybe overtime or additional money to crash the task. Project control. So the important thing is to monitor the project. It's never going to go exactly as planned, and so we need to keep some tabs on this project to see, is it progressing in the way that we wanted it to, the way that we intended. And so a Gantt chart is helpful in terms of looking at that to see if it is progressing. And if it is taking longer, then what can we do? So taking a project that's supposed to last 3 months and looking at it after 1 month to see the status is probably not the best approach. So the role of a project manager is to keep control and communications up on this project and see how things are progressing. So in a generic drug project example, maybe they have some things like large changes need formal sign-off by the project sponsor. Or all changes require greater than 10% increase or change in resource use must be approved by the board of directors. So you have these things built into your project charter, and if these things occur, then that's the direction you take. Risk management. Another element, should be an element of your charter, your initiation. Identify the risks. You could go as far as on a very complex project as doing a failure modes and effects analysis. But you'd want to at least identify what the risks are so that you can try to mitigate those up front. Put in steps to try to mitigate those risks and minimize the risks. So here in the generic drug example, well, we have some risks. A generic drug might decrease the quality of care. Maybe the computer systems can't handle these changes. And now that we're prescribing generic drugs as opposed to brand name drugs. And then what if the system modifications are more expensive or take longer? It drives the cost overruns. So those are some risks that could be identified in that project. Now we mentioned a little bit about procurement. How are we going to take care of this project in terms of resources? Are we going to contract out with a vendor to have this done? And if we are, well, then do we need requests for proposal or requests for information? And if we're going to contract to have it done, maybe how much time and materials is it going to take or cost? Are we going to have some fixed price? Or are there going to be other contingencies involved? Maybe they hit specific targets, and so they get price reductions. Or sorry, not price reductions. They get more money if they hit the targets. Get a bonus. The project management office is really important. It's critical to the success of the project because they are the ones that manage the projects. And within that, hopefully you would have your project manager, or at the very minimum, a sponsor. Okay, so they're responsible for tracking this project to make sure it succeeds, and then communicating with those groups to see if you're on track. At the end of the project closure is to close out the project and make sure that you track any lessons that were learned from this specific project. Okay, so now moving into something a little bit more specific. Agile project management is one type of project management. So up to this point, we've covered what are the elements of project management. Well, now we're going to talk about a specific type of project management. Agile project management is used often in software development. And what this is it's you achieve customer satisfaction with a rapid delivery of services. So it's constantly changing. You're examining this project constantly. And so you might have prototypes that are delivered frequently. And so you look at one prototype, you make some adjustments, it goes back to the customer. They look at it again, does it fit their needs? Yes or no? No. Okay, so now we go back and we change it again. It's very frequent and it's very rapid. Okay, so continuous attention requires almost a daily focus. Here's how the Agile process looks. Again, it's constantly working within these areas. It just goes in a circle. Okay, you start with the project charter, then you collaborate with the customer. So you work very closely with the customers on the project, much more so than you would on any other type of project. And then once everybody's happy, then you implement it and you go to scale. So often you'd build some prototype or some pilot first. Okay, so now we're done with the Agile project or Agile method of project management. We're going to talk about how can you examine this, and we're going to look at it in a little more manual sense first before we get into a project manager or project Microsoft project discussion. Okay, so using the network-based project scheduling, what does this do? Why do I care about looking at this critical path method of scheduling? Well, you want to see what's the estimated completion time, what's the earliest time each activity can begin and end, what's the latest time, and why might I care between the earliest and the latest? Well, maybe I have to put additional resources on this. Maybe I need to hire somebody. And so I don't want to hire that person, that temp worker, until the very last possible minute or moment. So maybe the latest time is important. Which activities have slack? Meaning, do I have some flexibility in terms of when I can start this project? And then how can I best spend money? Okay, so early start, again, start the project as soon as possible. Late start, you want to start as late as possible. Here are some of your symbols for how we're going to show this. And you can read each of these. But ultimately, the early start down here looks at the early finish predecessors. So there might be more than one predecessor, and it takes the maximum of those. Late finish what that does is that takes the late start successor and then takes the minimum of those. Okay, so whatever's after the late finish, it takes the minimum of those. Again, there might be multiple tasks. And then the early finish is just the early start plus how long that specific task will take. And the late start is the same thing, late finish minus however long it's going to take. Okay, so here's an example of how you'd see a critical path method in a visual sense. Start in this circle, you'd have the early start here, late start, and then the early finish is just the early start plus the task time. Okay, so let's see an example. You have an early start of 0, you have an overall task time of 3, so 0 plus 3 is just 3. And here you have a late start of 1, and so 1 plus 3 gives you a late finish of 4. And now the slack, I say the slack here is 1, it's the difference between the early start and the late start. Or you can also see the same thing in the early finish and late finish. Now, what I want to do is just, at the very end here, is just make sure you understand why we're going through this manual process. And the reason is I want you to understand the purpose. It's easy to go into Microsoft or MS Project and just plug in some numbers and see what happens. Well, the reason we're going through this exercise is so you can see what is the effect of slack in a process. What is the effect of changing the duration of a task that has slack? What is the effect of changing the duration of a task that does not have slack? And so those are the kind of things we're going to talk about in terms of an exercise. But that's why we're going through this, is so you understand what's happening in Microsoft Project, and it's not that you're just punching in numbers. So finally, what I'd like you to do is you can get a lot better explanation by watching this video. You can fast forward through parts of the video if you find things are starting to get repetitive and make sense, because it is a 30-minute video. But I think it does an excellent job of showing how you can complete a critical path method of project durations.